And the insulin just wasn't getting it under control. I mean, we were up in the doses, doing the glucose curve, and he was just running high. And so, gut feeling, I'm like, something's not right. Poor Toby, he's been quite a case for quite a while. So he was having some vision issues a couple months back. And actually, the morning I was bringing Zach in for Dr. Bailey to check him, Toby got up, and he's always been like just a food hound. He loves to eat, and he will like snap it out of your fingers, not intentionally being, aggressive or anything, but he'll get your fingers if you don't watch him. Well, he went to his bowl that morning and wouldn't touch his food and just sat right in front of the water bowl, and I mean, just took the whole water bowl down. And I was like, this isn't right. And so scooped him up, brought him along with Zach, and he wound up coming into the treatment room, and he typically doesn't do this either, but he drank a bowl of water. He urinated in the floor, and so we got the urine off the floor, and we checked his urine, and he had glucose in his urine. And so, of course, that led us to do some blood work, and come to find out he's diabetic. And that's been quite a little road we've traveled, and we put him on insulin, and the insulin just wasn't getting it under control. I mean, we were up in the doses, doing the glucose curve, and he was just running high. And so, gut feeling, I'm like, something's not right. And me and you, we were all talking about it. What could it be? And then you suggested possibly Cushings disease. So, and the funny thing is, with all the problems he's had in the last couple months, he's had blood work multiple times, and all of his blood work has come out just beautiful. I mean, it was fine. And that's how quick things take a turn.
Yeah.
And you tested him for Cushings and come back, and that's what it was. And of course, you know how to explain this better than I do, but Cushings can cause the sugar not to regulate with the insulin, and so there's your magic answer.
Yeah. So Cushing's disease is a hormonal condition, and so is insulin is a hormone that's involved with diabetes, and those two can interact with each other and they can complicate each other. So he's got kind of a interesting and complicated case.
Yes.
But I think that one of the interesting things is that, when we take a blood test and we run the full blood panel and everything's perfect, then that's just like everything's perfect right now.
Right.
And one moment in time, and it could be a month later or 6 months later that they can have something change. And it's interesting that it happened to you because we've been watching him so closely that all of a sudden this thing comes up. Which is good. It's good that we were watching him closely, and good that we're running the tests and that we were able to catch it, because sometimes they get diabetic and like a person, says, I'm drinking lots of water and I have headaches and I feel different, and they go to the doctor and they pick up on the diabetes very early.
Right.
And but dogs, so they won't tell you.
Nope.
And they just go on and it's like, well, he's not eating today, maybe I'll wait till tomorrow, and maybe, and then next thing you know, they're in a diabetic ketoacidosis, kind of crisis, and they have to stay in the hospital, and it can be very serious. About what is it like to have a diabetic pet? Because a lot of people think it's like the end of the world,
It feels like it at the beginning, but it's funny because it's one of those things, for me, which I'm very conscious about somebody peeing in my house. I don't want that to happen. I don't want the house to stink. Of course, nobody does. So you feel almost like you're tied to your house until you get him under control, because I'm like, every hour he has to go out right now because he's still not regulated. We're still working on it. And then, so it's, I have no patience. And so it's frustrating because you want it fixed yesterday. And I mean, obviously it doesn't fix that quick. You have to do this and adjust that, and it takes some time. And you just have to learn to be patient. And, of course, I know people that have diabetic dogs, and I was talking to one on the phone the other day, and she was like, it'll get better, She was having to encourage me. And I'm like, oh my gosh. But, it's, and then I think sometimes it makes them more clingy to you, because I tend to sit with him all the time. He's sitting with me at all times, or he's next to me, or I'm watching him, or I want to make sure he's okay. And like today, he broke into his dog food, so I don't know what's going to happen tonight with the sugar, because he had quite a meal while I was not home.
Overloaded himself a little bit.
So, I mean, you have to watch everything, but I mean, it'll get better. And it takes time, but that's one thing, is just, go with your gut feeling. When you think something's going on, just with him, I knew, he was diagnosed diabetes. There you go, it's diabetes, we're done. Let's get this under control. But then you just knew, I knew something still wasn't right. So you have to, and big thing is paying attention to him. Paying attention to subtle changes, which he was just one day not eating his food, and I was like, something's not right. But just going with your gut a lot of times.
Yeah, I think that's a big thing, because people know their pets, and they know. the drinking of the water is one of the most common things that they will drink more water than they used to, and usually they'll drink like twice as much water as they used to, and then they'll have to pee a lot because they drank so much water.
So accidents in the house.
So accidents in the house, yep. If they never have an accident in the house, or if they do have, like I have a little Chihuahua at home and she has accidents in the house, if it's cold outside, it's going to be an accident because she's like, I'm not going out there.
That's knowing your pet.
Yeah. It's normal for her on a cold day to go pee on the bath mat in the bathroom, but it's not normal for her to pee in other places. So if she would pee somewhere else, then that would be a sign that I'm like, oh, something's off, because they feel bad, they feel weird, and instead of just peeing on the normal spot, they'd say like, I'm irritable or whatever, they'll go pee somewhere else. And so drinking more water and having to pee more is a big thing. Sometimes it really stimulates their appetite at first when they first become diabetic and they just eat all the time. It's like, whoa, my dog is voracious all the time. And then as they get sick from the diabetes, they'll go to a point where they don't want to eat and they just won't eat. So
where Toby was, You know what was funny? When Toby, which could have possibly been going on for a couple of weeks, because I got a new dog bowl, and the dog bowl the water was empty all the time. And I kept thinking, well, the bowl must be smaller, a little smaller, and I'm just having to refill it, because I was like, I'm going back to my old dog bowl, because I was thinking it just wasn't enough water between the two of the dogs in the house.
Right.
And all along, it probably was him increasing that water, because he was having some issues with his sugar. So
that's a good point. So that just if you get a new bowl, it's kind of hard to do this. But if you have a regular system and you always fill it up to this line and it always goes down to here, and you get into a routine, like you get to know what's normal, almost down to the milliliter of how much water they drink, and they get onto a regular schedule of what they drink, and you can monitor that, or their food intake, or their weight. A lot of times, not only with diabetes, but with other diseases, they'll either gain weight or they'll lose weight. And sometimes you may not have a scale at home that's accurate enough, but you can always run them in here and just weigh them. Say, I want to weigh them in room 3 because I always use that scale, and then we can get an accurate chart. And that's really helpful for us in the medical record, is we will hit the button that says graph the weight, and it shows us a graph of what their weight is doing over time. And they're saying, whoa, she started losing weight here. Have we been trying to make her lose weight? Have we changed the food?
Well, another thing to bring up, and I might be wrong about this, but when they do tend to drink water, the first thing, or start drinking water and peeing in the house, don't be so quick to take the water away, right?
Right, because sometimes if you have kidney failure, their kidneys need that water. They're giving themselves dialysis, so to speak, like flushing their kidneys out with lots of water. They need, and if you take away the water, you can cause them severe dehydration. They get very sick from it. So
I've always heard, because you think, oh, they're drinking too much water, I'm going to take the water away, start withholding so they don't have pee in my house. But really, it's probably something else, and then you can make matters worse if you take that water away. So until you know there's no problem, don't take it.
Yeah. So some medications and supplements can cause them to drink more water. So if you ever have a question, something like that, just give us a call. And if something tips you off that something's not right, then we can check into it.